Hello everybody, John Dunbar is my name. I'm a retired orthopaedic surgeon, and today I'd like to introduce to you Dave Smith, who's a plumber, and we're going to be talking to him about his incapacitating back pain, which is fairly much ruining his life at present. But before we get into that discussion, let me give you a little bit of background to this. So this video is based on Dave's scenario where he's had some back surgery which he thought would relieve him of his pain, but it hasn't. He's been back to the surgeon who says, look, I've got nothing else to offer you, you just have to get on with life, pretty much. So that's a very unfortunate scenario to be in. But in medicine we also see situations where a person will present to you with symptoms, specifically in this case pain, and you do some tests and you can't explain their pain on the basis of your investigations. So what do you do then? Like you can say, oh, sorry, I can't explain your pain, I can't do anything for you. That's pretty unsatisfying for both the patient and the doctor. So we need to try and do better than that. These days, fortunately though, there's been a lot of work in the neuroscience around pain, and we now have good explanations for why people may have pain when you can't explain it on just the biomedical investigations. But these explanations involve employing a biopsychosocial model. And it's important we learn how to deliver an understanding of this type of model to explain a person's symptoms. But to deliver to your patient understanding, you need to be able to provide an explanation that makes sense. So you need to have a way of providing that explanation. So that's the basis of this exercise today. So I'm going to deliver an explanation to Dave about his pain. Bear in mind that although it's based on fairly sound neuroscience principles, this is my way of seeing the problem. And so a lot of it's quite individual. So there's no right or wrong way in particular to deliver an explanation. It just has to be plausible and fit with what we know about neuroscience. So having said all that, we'll get into the discussion. I'm going to skip a little bit. Normally we would start the first bit, where normally we would start with Dave telling me his history. But for an interest of time, let's assume I've listened to his story, and as he's been telling me his story, I've made some notes, so I'm going to summarize his story for our benefit. This is an opportunity for Dave and I just to make sure we're on the same page. So we'll start at that point. Dave, yes, I'm really glad you've come to see me today, and thanks for delivering that story. I feel really sorry for you. You're in an unfortunate predicament here. First thing to say that I think I can help you. So
I hope you can help me, because, a lot of specialists have told me that, but then it comes of nothing,
Yes, no, I totally get it. So what I want to do is start with a summary of what you've told me, and this is to make sure we're both on the same page and make sure I've got the right understanding. So the first thing is the pain. You've had pain on and off now for 10 years. Got worse. 4 years ago, you went to the orthopaedic surgeon who did a lumbar decompression. That worked for a little while, but then the pain came back. So 2 years after that, that's 2 years ago now, you had a lumbar spinal fusion.
Yep.
Again, the pain's come back. You've been back to the surgeon and he said, oh, sorry, can't help you now. In the meantime, though, the pain is actually getting worse. I think you feel it in your back and in your left leg, is that right?
Yep.
Spreading around your foot.
Yep.
A little bit more. It's very limiting. Can't do much.
Can't do anything almost. It's like even light housework around the house. I'm like doing the housework. Sometimes I stop because it's too much pain. Yeah. Sometimes I just, continue going and then pay for it later, and it's just so frustrating.
And you told me the things that you try to help the pain don't really work. Is that right?
Yep.
Medication?
Medication doesn't work. I mean, I'm on 3 other types of medication now, and they don't seem to be working, and it's just like a big circle.
Yeah, you'll be at a bit of a loss to know where to go, huh?
Yeah. It's hard. Sometimes I don't really know how to like get out of bed and stuff. But you know, hopefully, you might have the answers.
Yeah, well, and you've told me about a lot of your concerns for the future, quite rightly, given you know how things are going at the moment. You're out of work. You haven't worked for 18 months.
Yep.
Is that right? The boss isn't holding your job open for you anymore. ACC's being really scary, threatening to relook at the whole thing and your entitlements.
Which is kind of hard because I've explained to them everything, and it's just now all of a sudden they're investigating again, and it's just like, well, you know, I need help, but it's just like no one just is listening to me. I just don't know what to do.
Yeah, so a lot of uncertainty really about what the future holds. Huh? And a lack of a clear plan, you touched on that. You've been to quite a number of people, no one really knows what to do, but I'm hoping from today we can set you on a path towards recovery. So that's...
I hope so too.
Yeah, good. I'm looking forward to that opportunity actually. We'll have lots of questions in your mind though about your back pain, like why is it getting worse? You know, why don't the medications work? Why is it spreading around my foot? Is that right?
Yeah. I mean, like, am I the exception to the rule? Is something wrong with me? I don't know.
Yeah. No, well, there's not. We'll talk about that some more in a minute. And there's lots of losses associated with this kind of thing. When you can't work and no one's got an answer for you, there's a huge number of losses associated with that. There's like the financial stresses, but just the inability to, these are things you've mentioned to me, your inability to work has left you in a state of quite low self-esteem. You're feeling quite sorry for yourself at the moment.
Yep, all I do is like sometimes I can't even get out of bed, you know, like I'm sitting on the couch sometimes and feeling sorry for myself. It's tough.
I guess you used to see yourself as a strong, fit sort of person?
Yeah.
You haven't been able to exercise?
Fitness is gone, I know it's going, you know, I've gained 3 kilograms already.
Yeah.
Due to medication and stuff, so it's pretty frustrating. It's like almost feels depressed.
Yeah, not surprisingly, yeah. I think one of the other things you mentioned was the loss of social contact, because you used to enjoy going down to the pool club, and now you can't really stand up and cope with even being on your feet in the pool club. So you've stopped that, so you've lost that contact, not only with the people who play pool with you, but also with your workmates.
That's bad. Like that's like an embarrassment, you know. I sometimes have to go to their house as opposed to they come to my house, see me all sitting all sad and you know.
So I've been listening to how you feel about this. So I think it's quite important we clarify all the emotions around this. It's quite a painful thing to do, and you've told me quite a lot about that already. The embarrassment, some of the fears and uncertainty. What else? What other emotions do you feel in relation to this?
Just frustrated, depressed, stressed, financially stressed. Don't know about the job. You know, the boss won't hold it open, so stress all the time financially. Fitness is gone, so that's pretty much, you know, can't even walk the dog or anything. I have to like drive to the park and let the dog just play around. I mean, how like pathetic is that?
Well, it is. I'm sorry, it's smiling, but it's not. You're absolutely right. What you describe are a whole lot of what I would call the negative emotions. Those are the emotions that we really just don't want. We feel miserable, and we just want to escape that scenario. They're quite important. We'll come back to the importance of those emotions. So far we've talked about all the ugly stuff. You know, the stuff that makes us feel bad. Now I'm going to try and turn it around for you, because what I want to do from here on is explain to you how this has happened. If we can give you an explanation that makes sense to you, then you'll see the pathway forward, and I'm going to help you get there. So that involves taking a step back just to talk about some principles and some definitions. So let me tell you first of all about pain. These days we have various categories of pain. Now one that we all know about is called nociceptive pain. Have you heard of these, nociceptive pain or nociplastic pain? Most people haven't. Nociceptive pain is a kind of normal pain that you get when you injure yourself. So when you get a sore back, say you get a disc protrusion, that'll give you nociceptive pain because there's some injury that's occurred to your back. But when you've had treatment for that and the pain persists, we're always going to think, well, there must be some ongoing tissue damage occurring in your spine. Is that right?
Yep.
That's what's going through your head at the moment. Surgeon's done the scan though, and the scan doesn't show anything particularly bad, so it doesn't kind of add up, does it?
Doesn't.
So that's quite common. That scenario is common. So we now have a name for the other type of pain that people experience, and that's called nociplastic pain. So nociceptive pain is the pain you get from an injury. Nociplastic pain is pain that arises in your nervous system. It's kind of like circulating pain waves going through your nervous system. That's a weird concept, isn't it?
It is.
But that's the way I like to explain it to people is it's like echoes. You know, if you go into a cave and you shout once, but the sound keeps coming back on the sound waves.
Okay.
So nociceptive pain is like the shout. Something happens, sets off some pain signals. But whatever happens can get better, but if the pain signals keep coming, then it feels all the same pain, but that pain that keeps coming at you can be the nociplastic variety, which is that arrives on through the nervous system. So nociplastic pain is a disorder of our nervous systems, not so much a problem associated with ongoing tissue damage.
Great.
The problem is that to a person experiencing nociplastic pain, it all feels the same as nociceptive. But there are lots of clues in the story you give me that you have nociplastic pain.
And what is that?
That's the fact that it's getting worse, it's spreading around, nothing really works. Like normal painkillers don't work, but you'd expect an anti-inflammatory to work if you've got a disc protrusion or some other mechanical problem in your back, wouldn't you?
Okay.
So those are things we know that are associated with nociplastic pain. Let me tell you a bit more about how our nervous systems work so that you understand a bit more about nociplastic pain. And this is about the very basic functions of our brain. Okay? So one of the first things that our brain is designed to do for us is to protect us from harm. Does that make sense?
Yep.
We're no good if we're dead. If we do stupid things and we die, we're no good to humanity. So the brain is there to protect us from harm. So there's a part of our brain that's constantly on the lookout for threats to our safety. That makes sense too?
Yep.
Okay, now that part of your brain that's looking out for the threats is largely sitting at a subconscious level. I'll give you an example of how that would work. Someone sneaks up behind you and it makes you jump because you're not expecting them. You actually jump before you consciously realise anything much has happened. Is that right?
Yep.
Yeah. So that jumping is like generated at a subconscious level in response to the potential threat of someone sneaking up behind you. So that's how our brains work. I'll give you another example. Just in sitting on the chair there will be pressure on your backside from sitting on the chair. You don't notice that until I point that out. But some part of your brain will be monitoring that, and when it reaches a point where you're uncomfortable, it'll send a message to your consciousness to jiggle around and relieve that. Okay? So that's how our brains work. Now, when you perceive there's a threat, you will be sent a signal to warn you of that threat. And the signal in your case is pain. So what I'm really saying to you is that your nervous system is functioning in a way at the moment that perceives there is a very significant threat to you. Not surprisingly, you can't work, you can't do this, can't do a lot of things. So it's sending you a high pain signal. Whereas if a person isn't particularly threatened by whatever has happened to them, then you're not going to feel much pain.
Okay.
Does that make sense?
Yep.
Understand that? Okay. So how does your brain then decide what's the level of threat? So that's the next question. I'll give you a simple example of that. If you approach a small child with a needle and you want to take blood, how do you think they're going to respond to that?
You're going to be scared.
Yeah, and they yell and scream and everything, don't they?
100%.
Yeah, so they're scared. Or anything else that you think they feel or they experience? What are they thinking about?
Scared would be the biggest.
Yeah.
And they'll be like afraid of what's going to happen.
Yeah, they're scared and afraid, and they expect what?
They don't know what to expect.
They don't know what to expect, but they're looking at this very sharp needle, so their expectation is that's going to be pretty sore.
Yeah, that's going to be pretty sore.
Right. So your brain, everybody's brain functions like that. So I'm going to draw some pictures as we go along, but a couple of the most important things that determine how our brain perceives the level of threat is related to our previous experience and our expectation, just like the child about to have a needle in the arm. That's one. Another one is the emotions around that, like fear, uncertainty, and you've got heaps of that, all those negative emotions. So if I draw a picture here, here's your brain, my brain, anybody's brain, and I'm going to divide it into the conscious part and the subconscious part. So when something happens to us, no matter what it is, in your case you've got some messages coming from your back. Those messages are going to come up a nerve pathway here to a part of your subconsciousness which is going to decide what to make of that. Is that right?
Yep.
Kind of what I've been trying to say. And this guy doesn't really know. So he's going to take some advice and he's going to look at your previous experience, which is going to set the expectations around that. So we have in our brains here a store of previous experiences, so I'm going to draw that there. And as we've been talking about, there are a whole lot of emotions around us as well, which in your case are all not surprisingly quite negative emotions.
Okay.
So where the expectation is that this is going to hurt a lot, and the emotions are negative, they're going to put this guy who's sitting in your subconsciousness trying to make sense of this, they're going to put the wind up him. And he's going to think, oh, what's coming now? And he'll send you a high pain signal. That makes sense?
Yep.
I like to call this guy here, I'm giving him personality actually. It's quite handy to think about this guy here in terms of a personality, because what that helps you realise is it's not your fault that you have this pain. There's no failing on your part. It's just the way our nervous systems are designed, and sometimes people can inadvertently go down this track. So it's not your fault. We can blame this guy. And if we blame it on somebody else, it helps to put it out there, and it gives you someone that you can, attack and deal with and get him out of your life. Kind of like the guy who's bullying you, right? I call him the integrating centre, because he's got to integrate all the information that's coming in to make sense of it. And there's a few other things that stir him up as well. And you mentioned that a little bit yourself.
Yep.
It's your level of stress. Do you feel stressed?
I feel very stressed.
For good reason.
For sure.
So you'll be, I can put a big stress bubble here too. This is stress. Stress puts our brains on high alert, because we need the stress response when we're going to respond to, the tiger who's going to come and eat us or whatever.
That's true.
Yeah. And then lots of uncertainty, anxiety, lack of a clear plan, that all feeds into the negative emotions and the stress response. So essentially this guy here, the integrating centre guy, he's got a whole lot of stuff feeding him to put him on high alert. So that's the way he's responding to the current messages coming from your back.
So what can we do to,
Let me tell you one more thing. there's a concept called neuroplasticity. Have you heard of that one?
Yeah.
What?
I
Yeah.
haven't
No.
heard of it.
Okay. You know what something that's plastic is? It's sort of moldable. Okay. Neuroplasticity means that the nervous our nervous system is moldable. Like it responds to how much we use certain pathways. We all know that actually, because what I'm saying is you get better at what you practice. Don't we? If you want to walk, you just get up and walk. The walking pathways are established somewhere in our brain, and we just flick the switch and we walk. All we need to do is consciously decide how fast and where we want to go. So that's an example of how nerve pathways will develop. So currently, neuroplasticity means for you that your body is extremely good at doing pain pathways and everything that goes with that. So if I were to draw a picture of your brain now, then the pathway bringing the impulses from your back to the brain is really well established. So instead of that being like, you can see that there, instead of that being like country road, it's now like the Auckland motorway, assuming it's flowing all right, like multi-lanes of traffic. And then the integrating centre here is like Queenstown Airport, all these Australians coming in all the time, has to get bigger and bigger to cope with the influx.
Yeah.
And as he gets bigger, he has a relationship with all these other things I've been drawing, so that as you have been experiencing, your negative emotions get worse and worse and worse. Your stress level goes up, and even though things might be healing in your back, your pain level can go up just because this pathway is much more better developed.
That makes sense.
Dave, do you believe you can get better?
I have a bit of hope. My mum always said, have hope, and that's what I believe, and I think so.
Yeah.
But it's tough because, everyone else said to me, do this, do that, and, never really went anywhere, so it's quite a hard thing, but I do have hope.
Yeah, well, hope's the start, isn't it? Without hope, you get nowhere. Until today, you didn't really have hope anyway. So if you've got hope now, that's a good start. I appreciate it. It must be quite hard for you to even trust me or believe what I'm telling you. Do you find that?
I find it difficult.
Yeah.
But, like anything's better than nothing, in my opinion.
Yeah, okay, good. Well, I can appreciate you. I'm just like any other doctor. Our doctors in the past have told you things and it hasn't really worked out. So it's hard for you to accept that what I tell you might work for you. But the one thing I can tell you is that this kind of approach, where we're talking about how our minds work and neuroplasticity and how we can turn around our nerve pathways, has revolutionised the way I practice medicine in the last 10 years. And I've had this discussion lots of times, and I enjoy it every time because I know that it works. And I've seen lots of people very similar to you, but with all sorts of pain issues, who've been able to get themselves back on track. But it does require quite a change in the way you think and behave. But that, that doesn't changing the way you think and behave is actually not. It has no downside. There's no risk in that. So if you're prepared to give it a go, I can tell you that you will be better. And we've talked about nociplastic pain. You have nociplastic pain. Nociplastic pain responds to changing your nerve pathways. So if you can believe me and we can change your nerve pathways, your nociplastic pain will get less. There is no doubt about that. So that's the exciting thing.
I think the way you say it and the conviction that you have about it and so passionate about it, I think I have hope and I do believe you.
Yeah, okay. Well, how do we get there? That's a big question. Everybody asks, well, what do I do? Okay, I accept that, what do I do? We need to change the way your pathways are working. So we need to shrink down all these overactive bubbles in your brain. So we So in simple terms, we want to do what we can to decrease the messages coming from your back to this integrating centre guy. So that means we need to be kind to your back. You can't push through stuff. So that just increases the traffic.
Okay.
You see, so it's kind of like we've got to starve the integrating centre to death.
Okay.
We diminish the impulses from your back. We deal with your stress. We deal with your negative emotions. You might say, well, how do we do that? But, you know, there are lots of stress reduction techniques and there are lots of ways of dealing with negative emotions. But it takes a bit of learning that, and you have to practice that. But as you shrink these things down, the pain will get less. I'm asking you to believe me now because you haven't seen that yet.
I haven't seen it.
But
I want to trust. I want to believe.
One of the ways to, one of the best ways to achieve that sense of belief that you can get better is to be in a group with others where you're all working together, and if you see the improvement in others, it's a real stimulus to you and it becomes positively reinforcing. So we're really lucky that we have these multidisciplinary teams now who help people with your type of pain. And in those teams, they hold sessions with a group of people often. You can compare stories, help one another along, as I said. They usually have a physio who understands all this, who's not going to push you too hard, but going to help slowly build up your physical tolerance again. And they usually have a clinical psychologist who teaches you some of the tools about how to calm down your stress bubble and how to deal with those negative emotions. You don't have a psychological illness, but there are tools that a psychologist can teach you to help.
Do you know
things like mindfulness?
Do you know I've been to a physio and they've given me core exercises and exercises, and it didn't really help.
No, I understand that. But what you need is a physio who understands pain processes, and because with all due respect to physios, quite often you go to the physio, they say, oh, well, you're weak here, so you need to do this exercise and that exercise, and all that does is make your back sore. Is that right?
Yep.
Yes. So the physios attached to those teams will not do that. They start at a level that you can tolerate, level of exercise that you can tolerate, which might not be very much. Then they'll build it up. As you get better, you can do more and more. There's a really good team in Dunedin that I'd like to refer you to. Would you be okay with that?
Yeah.
But I'd like to see, again, there's a lot more we can talk about. And just to reinforce some of these ideas, and I'm going to give you my drawings and some of these notes I've made. And I think it'd be really helpful if you can look through them and get your head around it. And as part of getting your head around it, it's quite helpful if you can explain it to your family and your friends. And then it helps to clarify, you know, points. And your family and friends may have ideas and they'll chip in from their experience. So you build a kind of a picture of what's happening to you and where we need to go. I'll make the referral to the multidisciplinary team. But if we could see you in a week, then we can clarify anything. I can add a little bit more detail around, quite a lot more detail in fact, around what we've talked about, and then go from there. But you've got my word, I'll be with you to act kind of like the coach to help guide you along. Because I know personally that you can get a lot better. And you might not see it yet, but I know. So if you trust me, we'll get you a lot better. I want to see you back at work and functioning in life much better than you are now. So that's the goal.
I hope.
Yeah. Happy to come along for the ride?
Definitely. I definitely need someone by my side because it's been just by myself all the time. Specialists see me and it's almost like discarding me.
Great. Okay. I'll be there. Any other questions?
Not for now.
Great. I'll look forward to working with you, Dave. And yeah, I think you have every reason to be hopeful for the future.
Yeah, so it was really good seeing this doctor. You know, everyone seems to be, all the specialists I go to is just, they give you something, if it doesn't work, they just discard you like you just, you know, just a number on their sort of sheet of paper. But this doctor seems like he wants to help me, and that's like probably the best thing I've ever had in my corner, you know, like I need that supporter. He's going to be there like from day one till I get better, every step of the way. he's quite passionate about what he wants out of this as well, which is, it's good to see. It's tough. It's really tough, being, just day-to-day activities. I can't do anything, honestly. Like, are you serious? Like, I can't do anything. And like, no specialist wants to help me. I've been to the physio, I've been to the specialist. One specialist told me, just do work hardening. Like, what does that even mean? I don't know what that means. The people at work, they tell me shirking. You're just shirking off work. Like, they don't believe me or anything like that. And it's just like, are you serious? Like, can you not see I'm in pain? Like, I can't physically walk. I just don't know. Like, it's so hard. It's so hard to even like think about stuff. Like, at least this GP, he wants to see me succeed, and I want to succeed. Like, I really want to succeed. Like, but it's it's difficult to get out of bed. But if he can believe in me and I believe in myself, surely something will happen. Like, anything's better than nothing. No, not even the medication helps. Do you know what I'm saying? Like, nothing helps. But he's got a plan, and I feel much more better about the future. Like, I feel like I can actually achieve something, and I want to achieve something. So I reckon with his help, I can do it. Like, I can do it. Like, and honestly, like, no one believes in me, but he believes in me. So surely, if he believes in me, I believe in me, we all can do it together. Surely.